Welcome to the second video in this series. Now that we have an understanding of how to leverage a customer's wants, needs, and pain points to help build a tailored demonstration of the product. Now it's time to get into the meat and potatoes of this block of instruction. The principle learned during the car shopping example translates directly to Focal 1. Before the demo, engage with the customer. Understand their interests in Focal 1, their aspirations, and the gaps in their current solutions. Be curious, seek to understand why they have gaps in their treatment plans and what is the root cause. Determine the customer's clinical, operational, and economic anchors, reference them throughout the demonstration, and highlight the Focal 1 value propositions that tie directly to the customer's anchor. Remember, the test drive is not an educational or instructional activity. It is a core selling tool for customers to validate the technology and progress in the sales cycle. Prepare for any demo as though it were in an office sales call. Preparation: do your homework. Understand all you can about the customers. Where did they train? What is their reputation at the hospital? Who do they respect? What is their personality profile? Create a value hypothesis and test it during your impactful opening. Understand the hospital's financial situation. How do they usually acquire new capital, and what are the hospital's strategic objectives? Open with impact. Tailor an impactful opening to your customers' priorities, competitive landscape, practice structure, and understand the institutions they respect and look to when evaluating new technology. Craft a story that is personal, answers their WIF, and forces them to state an opinion. This will help drive the rest of the conversation. It also shows the customer that they are not just another urologist in the long line test drives in the area. Storytelling: paint a vivid picture for the customer. Create a scenario where they do or do not adopt Focal 1. Create a sense of urgency with the story. Make the surgeon the main character or use a similar surgeon profile who successfully or unsuccessfully adopted Focal 1. Build tension and share what might happen if they don't address their problems or limitations. At the end of the presentation, make the customer the hero, with problems solved and needs addressed thought, partially, the adoption of Focal 1 HIFU. We are in a mindshare battle with our competitors. What can you do to separate yourself from the commodity-focused competitors? Establish clinical and business stature with the customer. Show them that you are an expert at your craft. Use this dedicated one-to-one time with a customer to ask detailed, multi-layered probing questions. Each root question should be followed by 2 or 3 clarifying questions. Make sure you understand the true root cause of the customer's issues. This is Dr. Smith. She is an SUO-trained urologist at a mid-sized academic center. She is early in her career and is still building her reputation in the community. Dr. Smith is generally conservative in treatment, but very patient-focused. She has the highest Press Ganey score in the department. She has shared that since she started practice, she notices a lot of younger men, 50 to 70 years old, getting a radical treatment for low or intermediate risk disease. These are her hardest patients as they are never satisfied with the functional outcomes. Compared to generations in the past, men are more active later in life and have a desire to maintain their sexual activity as they age. No matter how delicate the nerve-sparing dissection or how watertight of an anastomosis, these patients are always unsatisfied and often wish they stayed on active surveillance. The hospital investigated cryoablation for lower-risk disease, but the functional outcomes were awful. They ended up losing a few referring physicians because of the poor outcomes. The hospital's biggest initiative this year was to reduce surgical site infections. The urology program had worse numbers than most, as they make many open incisions to remove the prostate and do a lot of complex kidney and bladder work. They need to find a way to reduce their SSI rate. Finally, the hospital is in a very competitive market, with 5 other hospitals. Dr. Smith's hospital was late to the robotics game and lost the consolidation fight 10 years ago to their competitors. They are now the 5th busiest practice in a market with 5 hospitals. To recap, Dr. Smith is worried she is too aggressive with some prostate cancer patients. Functional outcomes and patient satisfaction is important to her. The hospital's priority is to reduce cost associated with surgical site infections and to take market share from their competitors. An average sales professional would take this information and run with it. They have the quote built in their head and implementation timeline all drawn up. But they would have left a lot of meat on the discovery bone. The clinical and capital sales team at Focal 1 are not average reps, watching the clock and managing inventory. This is a special organization with a special technology and a bright future if we can improve our close rate and validate Focal 1 faster. The Focal 1 sales force are disruptive agents of change. In order to build programs, We need to know the intimate details of a surgeon's and hospital's priorities. So, when they give you the information on a platter, don't accept, ask more questions. For this example, the sales professional might ask the following. 1. Why do you feel like you might be overtreating patients? 2. What are the consequences of overtreatment? 3. How do you decide between active surveillance and a radical procedure? 4. How do you counsel a Gleason 7, 3 plus 4, versus Gleason 7, 4 plus 3? 5. What would acceptable functional outcomes look like for a younger man with intermediate risk disease? 6. What do those patients share during follow-up visits? What are their expectations and when do they feel frustrated or upset? Now that we know what is important to Dr. Smith, we can highlight the features and benefits to build a value proposition for Dr. Smith. During the test drive, the sales professional could include the following during their demonstration. I understand your concerns about overtreatment. This system was tailored for urologists to ablate prostate tissue. Other focal technologies were designed and built and then looked for a market. We spent a considerable amount of time getting feedback from your peers to make sure this system has everything you need to build a true focal HIFU program. Now let's look at the power of HIFusion software. Since you have a well-established MRI program, I think you'll see the software as a real differentiator. As you can see, the Focal One is able to import, visualize and perform elastic fusion of the MRI image at the time of treatment for enhanced precision. You'll be able to isolate the diseased tissue, sparing the neurovascular bundle, the prostatic urethra and muscles. The software using elastic fusion to adjust the MRI image to overlay on the real-time ultrasound. This is the dynamic focusing probe. It allows for real-time imaging, with the highest quality ultrasound imaging transducer on any HIFU system. The probe has 5 degrees of freedom and can ablate up to 30 cc of tissue per hour. So a focal case usually takes about 45 minutes, with a hemi taking about an hour. It allows precise energy delivery in 5 mm increments up to 40 mm in anterior to posterior length, expanding the distance previously available. The system constantly monitors the position and temperature of the rectum. The algorithm is able to move the probe with the prostate, maintaining the perfect position without manually adjusting the probe. NBSP, this is the ablasonic fluid. It is circulated during the case to maintain an optimal temperature in the rectum during the procedure. Patients have asked their urologist at the follow-up appointment if they really did anything to them, that they felt great a few hours after the procedure and were very happy with the early results.
You want details? Fine. I drive a Ferrari 355 Cabriolet. What's up? I have a ridiculous house in the South Fork. I have every toy you can possibly imagine. And best of all, kids, I am liquid. So, now you know what's possible. Let me tell you what's required.
Exceptional test drive is a nuanced skill that requires practice and refinement. Like we discussed, it would be very easy to sit a customer of the system and show them all of the bells and whistles that will solve all of their focal problems. This organization and its commercial teams are better than that. To recap, understand your customers' needs and priorities. Ask multi-level questions to get to the root of the problem. Create a story using the information you gained and understanding of the customer's anchors. Make the customer the main character, so what's possible, but also highlight the consequences of inaction. Thank you for your attention. The final module will discuss setting up the Focal One for a test drive and describing the optimal test drive workflow.